Hey y'all. So 5 reasons why Black women are suspicious of the medical system. 5 reasons why Black women are suspicious of the medical system here in the US. I am Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So our goal as doctors and healthcare workers is really, specifically for pregnant women, is to keep pregnant women and their babies safe and healthy. That's our goal. That's what we train to do. That's what we do, but many Black women are suspicious of the medical system. So why is that? There are many reasons though for that. And I really do think that Black women are justified in side-eyeing the system. So let's talk about them. Number one, the Black maternal mortality crisis. The crisis is real. We know that Black women are 3 times more likely to die during or after pregnancy than white women in the US. Black women, they hear about it all the time in the news, radio, and social media. They hear about the deaths. They hear about the near misses in pregnancy, and they're rightfully scared. I would be scared too if those are all the messages you're getting, all right? Number 2, Tuskegee. Most of us have heard about Tuskegee. Black women are scared because of the Tuskegee Experiment, from the 1930s all the way until the 1970s. Here in the US, in Alabama, 600 Black men were enrolled in a medical study, all right? They thought they were getting help. They thought they were getting treatment, but instead they were giving them vitamins and minerals, so placebo. The US government, this was doctors in the United States Public Health Service, was studying the natural progression of syphilis in Black men. That's what they were studying. They weren't trying to treat or help these men. Even when penicillin became available in the 1940s, they didn't treat these men. They continued studying them. They watched them die. Many of them died. Families got sick, kids, wives, and also died. Until the study finally got shut down in 1972 after multiple whistleblowers found out about it and got it to stop. That, Tuskegee is one of the big things that we have medical mistrust in this country. All right. Number 3, Dr. James Marion Sims. He has been called the father of gynecology. This was a white OBGYN doctor. He did research, on enslaved women. He did research on them. He operated on them without anesthesia. Their names were Betsy, Lucy, and Anarcha. These were women who had complications of childbirth that led to something called fistula, which were abnormal openings that caused you to lose urine and not be able to hold your stool and your bowels. And he operated on them, did tests to fix these conditions that they had without anesthesia. And this man was celebrated, y'all. The Sims speculum, which we all as OBGYNs use when we're caring for women, was named after him. He was the president of the American Medical Association. So this is someone who just ascended very high. They call him the father of gynecology, but he really makes people like us and many of us OBGYNs ashamed of that history. All right. Number 4, the 2016 pain study. This was, we're talking about history, but we're also talking about not so far ago. There was a study published where they surveyed medical students and doctors, residents, and they asked them different questions. And, these medical students and residents believed that Black people had thicker skin than white people, and that Black people felt less pain. And not only did they believe that, when they had that belief, they provided less pain medications to Black people, for example. So this is something that's not just this is like modern times. This is like recently that this happened. So this is real. It pervades our medical experience, our training, our education, and a lot of people still believe that race is a real thing. Race is not real. It's it's not a real biologic thing. It's a social construct that was created, around slavery, around colonialism, to say these people are different. There's no gene for being Black or being Hispanic or being white or being Asian. There's no gene. All right. Number 5. there are many, many examples. The reason for this medical mistrust, many, many examples of abuse. The US government, for example, there did thousands of forced sterilizations to make women not be able to have babies anymore. They did that in the Indian Health Service in the 1970s. Most recently, in the past few decades, they did them in women in prisons here in Georgia, where I'm in Atlanta. So this is real, all right? And currently I'm actually reading a really good book. It's called Legacy. It's by a doctor called Dr. Uche Blackstock. And she talks about institutional distrust, which I was calling medical mistrust, and that places the blame on us, on Black women, for not trusting the health institution. She says we should instead be using the term institutional untrustworthiness. I love that because the institutions have shown us that they're untrustworthy, by abuse and mistreatment in our communities. So that's why people are scared, and that's why people sometimes feel like we're out to get them. Even when you come and you want to help, that history is there. So Black women, these are some of the reasons why you're scared. We know, we hear you, this is validated, it's based in reality. We see this and we know that it's up to us to do better because we need you to survive and thrive, all right?